when we talk about funding in general, that word could mean very different things to different people, especially to investors or people who are investing. So Steve, you're an investor, you're a venture capitalist. Could you help us understand the spectrum of funding a little bit? What does it really mean, especially in the context of assistive technology products and startups?
Yeah. So thank you very much for the question. And Mohamed's experience actually gives me a segue for the first point. Again, the objective is not to lecture people, but really to make you understand that for us as investor, actually the first funding source is your sweat equity. The time you're spending, the energy you're spending, your sweat equity, we call that, right? That's number one. And then usually when we see that, we used to call them the 3 Fs, friend, fools, and family. I think most people say friends and family now. But the fools are those people who actually believe so much in your idea that they give it to you, but they haven't seen much, right? So yourself first, the 3 Fs, and then obviously beyond friends and family, any organization that can help you develop the product. So when you look at the spectrum of investments, those friends and family could be what we call angel investors. That are originally a word from Broadway, actually, which were essentially people who were willing to fund a theater. They were called angels, and it was translated to investments, which is basically angel investors, okay? So they believe in your idea and give you money. And then, over the recent, I would say 50 years, incubators and accelerators came up with various models to provide you either a grant or equity, which is shares, or a different instrument that will help you really understand, see that sometimes you can get money now and release a bit of shares later. So generally, that is it. So I would say you first, friends and family, angel investors, which are people that you know around you or beyond your immediate networks that are willing to fund you, and then incubators, accelerators. And then once there's some few proof points, and I'll mention a couple of them, then you have what we call institutional investors. And those institutional investors are people like me who, it's not always my money that will be used, it's other people's money. So you have to create an institution for people to give you money to invest in other companies, okay? So these are venture capitalists and others. So maybe a point that Mohamed mentioned that I want to get back on is the combination of grants and I would say investor capital, be it yourself and other people's money, okay? In assistive technologies in particular, because it's what we call deep tech, meaning it's research, engineering based, it's very important that, unfortunately in our ecosystem, we don't have the facilities that certain markets have where you have government money that really support entrepreneurs to transfer technologies from universities, ideation and engineering. Here, you need to spend time to really work with organizations as a number of them that are here to get a grant to kind of de-risk that for investors to come in. I'll finish with one point, which is over the recent, I would say 4 or 5 years, I've coined kind of a new business model, which is, or grantpreneurship, I call it, right? People go after grant is entrepreneurship, but through grants. In one way, I find it a bit negative, but on the other side, I think sometime it's a pathway to be from a B2D, that's the word I coined, business to donors, B2G, business to government, to a B2B, business to business or business to consumers. I think there's a space for that. And so maybe an appeal to a number of the stakeholders here, you might consider looking at options to develop that B2D or business to donors or business to government or solutions with grants and other solutions to the risk for us as investors. Thank you.
All right. Wow. I feel like we just did a investment 101 masterclass. I'm going to be asking questions, so I hope you are taking notes. Now, I think this is a good segue to talk about, I mean, if you're talking about investment, surely there must be a market, right? Because then what are we talking about? So I want to bring in Klaus here, and then before I bring in Klaus, I don't know whether we've looked at some of the reports that we now have on how big the disability market is. Any contributions from ladies in the audience? Again, do we know how big the disability market is by estimate or by some of the numbers we've seen? Yeah. We're gonna go with a lady at the back with a hijab. $8 trillion market. Okay, you heard that. It began with a T. Okay, how many people do we think need assistive products today? Another contribution from a lady in the audience? Yes?
I mean, we're looking at 15% of the global population being persons with disabilities, so I would assume something around 15% global population.
Okay, so you're talking about 15% of 8 billion people. How many mathematicians in the room? How many people are those?
12
Yeah, we're talking about 2 billion people
We're talking
together,
about,
together with all the relatives and friends and so on. Yeah.
Yeah.
But
So-
the thing which you have.
So
really
there's a market. Klaus, you're saying there's a market, right? Yeah. So tell us a little bit about this market, because one of the challenges of the assistive technology market is the idea that even though it's a huge market by the numbers, like those who need assistive products, the criticism or the pushback we always get, especially from the likes of Steve, is, but is this market viable? And can you actually,
otherwise, you know?
and can this solutions actually scale? So Klaus, you're doing something very interesting to kind of scale assistive technology businesses across Europe. Tell us a little bit about that and your perspectives on the AT market.
Yeah, I would say I'm the second F. I'm the fool. Yeah? The thing is investing. Yeah, what is investing? Yeah, that's the crucial question in the beginning. Yeah, investing can also be investing time, investing trust, investing my employees' time, for example. Not only money. It's not investing my knowledge in the people that are coming to me and to try to find the right market. Yeah, and that's the thing. There are so many dreamers outside. Yeah, and there are so many, let's say, reinvention of the wheels every year that we have. Yeah. Look at there's one boom market now at the moment is for example sign language translation. Sign language translations apps. You find it everywhere in the world. You find it in Europe, in Africa, in India, and they're all doing the same thing. Yeah. But for me, the crucial thing is, does the customer want it? Does the customer really, first the need of the customer, yeah? And second one is, do we really have a market who wants to buy this products? And I can say, okay, if you're talking about products for persons with disabilities, we are still speaking about a niche market. Also in Europe, we have to bring it to the mainstream. We have to bring it to the mainstream, like we brought it to the mainstream with this thing. Everybody has it. Yeah? For example, if you have any product which can help a customer with a disability and a customer without a disability, then we are on the win-win side. And then we can sell it also. Yeah? The second thing is, going back to that what I said before, yeah? The dreamers. People are coming to me with an idea. Yeah? The idea is nice, but it has to be tested against the customer. It has to be tested against the market. And that is the thing that we are providing for the people that are coming to us. We want to have a minimum viable product. We want to have a minimum viable service which can be tested. And if the customer says, no, that's not the thing that we need, that's not the thing that we want to buy, yeah, then you have to change it. Yeah? And the third thing is about investment. What I had to learn in the last, let's say, 10 years, yeah, the probability that some of the products will really be sustainable and really will be on the market after 5 years, yeah, is 20%, the maximum. Yeah. Most of them will fail. Most of them will fail, but the thing is, if you invest in 10 companies and 2 companies are really, let's say, rocket racer or whatever, yeah, then you are on the right side. But you have to be aware, if you invest, that 80% of the companies that you're investing in are failing, yeah? And that's a fact. Yeah? And when we speak about the market, that's the next thing. Yeah? We spoke about 1.8 billion to 2 billion persons worldwide. Okay, this market is very fragmented. Doesn't mean I'm always looking for it's like a zero project, which you will hear tomorrow. Yeah, we are looking for solutions that can be, let's say, brought up in India, in Africa, whatever, and we can bring it to, let's say, other parts of the world and scale it up, scale it down, customize it, whatever. Yeah, sometimes this is simply not possible because it's only for the market. It's designed for the market where it came from, and we can't adapt it to the needs and to the wants of the persons in the other markets.
Steve is burning with a rejoiner.
Correct. Yeah.
So I'm gonna allow you to come in.
Yeah. So I wanted to add something that Klaus mentioned about market. From our perspective as an investor, it's very difficult to assess the existence of the market, the size of the market, and I would say the attractiveness of a solution in medical devices, but in the assistive technology in particular, until there are indications about ISO approvals, local approvals of any regulatory body, and in the case of what Mohamed said about Bionics, which is, trials and approval by a regulated body that helps to tell us that whatever prototype has been developed has market potential. So if you get a CE mark, ISO approval, US FDA, or any recognized regulatory body, it's also a sign for us to say, okay, this product has at least the ability to access a potential market. So from our perspective, we look at those stages as critical as investors to monitor and invest, right? So, and Mohamed said it very well. Unfortunately, a lot of AT solutions are not working backwards to say, okay, I'm a class 1B, whatever device, potential device. Even knowing that information is quite difficult to get by, as he mentioned. So I think there's a lot of education early on to AT entrepreneurs to know what category of device they could be or solution they could be, number one. And number two, what is the pathway to get there to, one, create a market, but also to make themselves investable for investors like us, because we often don't know unless we have an internal tech team or deep tech team that can assess the potential, knowing, okay, this device that we're looking at or this solution that we're looking at that's going to provide accessibility could be categorized like this and therefore has a market potential of this size. Okay? So it's very critical to determine the market as a function of the regulatory process pathways that is driven to it. Thank you.
All right. Wow. So a lot just there. But just to recap a little bit, and I'll just go back to Klaus. There's something interesting he said. Does the customer want to buy it? I feel like that's a really powerful question. And since here we are talking about the person with disability as maybe the primary customer or user, sometimes they may not be the one buying or making the buying decision, but I find this to be a very interesting question. Do persons with disabilities want to buy assistive technologies? Or do they want it for free?
You can do a poll.
We can do a quick poll here.
Yeah, do a poll.
How many of us want it for free? Show of hands. Come on, be honest. How many of us want to pay for it? Okay, so I'm going to pick you because you said you want to pay for it. I'm going to ask you, why would you pay for it?
I mean, for starters, if I can get it for free, I would rather have it for free. But if it is something that I can buy and I can afford it, then definitely yes. I think anything that comes into my life to make my life better, then I would definitely want to purchase that.
Okay. So she said, if she can get it for free, she's going to get it for free. But if it's affordable, she could buy it. I think there's one more contribution I'm seeing at the front. I'm going to bring in the men, finally.
Thank you for removing the gender bias.
Okay, please go ahead.
See, coming from India with an experience of working in a developing country scenario, and which is pretty similar to that in Africa. Generally, over generations, people with disabilities have been sort of mindseted of, basically they have been told that you will get everything for free. And that is the biggest challenge. The mindset is, I am disabled, hence I should get this for free. And that creates a big barrier when it comes to developers like Mohamed, like Hani sitting next to me, when they, even if they create affordable devices, the market is very, very fragmented, very fragmented. That's what I would like to bring it at this point. Thank you.
All right.
But
So,
sorry, this would be
Klaus?
like I'm an Austrian and I'm getting skis for free. Yeah?
Okay. Okay. I mean, guys, this question might sound like it's a trick question, but it's a very fundamental question, because one of the trends that is shaping the disability market right now is an idea about the agency of persons with disabilities, right? Like their voice, their preferences. A lot of the time, if somebody gives you something for free, you don't have too many options, isn't it? It's the only thing you have to take. But what does markets bring? It brings choice. It brings the idea that you can check what is better or fitting to your needs. It actually empowers people with disabilities to have their own agency and have a contribution in the products that they use, even learning about the knowledge of what is the AT products that we need. And I want to jump now back to Mohamed. Now that we're still talking about free versus paid, what is your experience trying to sell or promote the idea of selling a bionic arm? Once an entrepreneur told me in this country that it's very hard to compete with free. Like, if the government decides to give all the people that needs prosthetic arms,
Okay.
how will you?
Okay. So first of all, I guess that for every entrepreneur in the AT field, it should be a co-design process since the beginning. Because some of the features are forced on people with disabilities in the products they're giving for free. For example, one of my team members, he was born with a limb difference. He's using a prosthetic, the old one with, let's say, given by the government, but he's having, for example, some allergies from the materials. He's having some features that are not really suitable for his usage. And during our, let's say, development or co-developing process, we've been listening to this feedback and to what people think of the product they want to pay for it. So we got some people like saying, yes, we already have a prosthetic arm, but if we get this special or that feature, yeah, we can go and buy another one, or we can upgrade in the future. So I guess the more the product is tailored and co-designed and continuously upgraded, people will go and pay for it. And I guess I want to just do one small follow-up remark regarding like entrepreneurs for the AT field. I guess that, as I explained in the beginning, first of all, don't think about the regulatory part as an extra or as a comfort. Take it since the beginning. Just have an idea about it because it will guide your product. So basically, we reduced our product from a class 2 to class 1 to avoid a lot of troubles. And that changed a lot of the product itself technically, but also impacted the supply chain. Because when you go certified, you cannot buy your supplies from anywhere. And you should have plane A, B, C, and D, let's say for your suppliers, because the day that supplier is not available, you should have another qualified supplier to keep the same product or same quality. Another remark here, you can build small products from the big products. For example, we developed everything in our bionic arm. It took us too much time, but we developed everything: electronics, coding, sensors, the 3D design, mechanical thing. But when we developed the sensors, we could think of launching a sub-product, for example. We did it now, but we could do it in the past. For example, a rehab solution or a muscle signal detector. We have the sensors, but we didn't think of that. So that's another advice. And the third thing, try to launch softer versions of your product. Don't think about all or the full version with all the features, with the perfect features. Sell or launch, okay, I should cut, I guess. Yeah, I guess we, yeah, thank you.
Okay, guys, I know it's getting interesting, and some people are telling me we are out of time. But we're gonna wrap this up in a very interesting way, because what's the purpose of this discussion? It's not just to come here, hear some interesting facts. I think there's a fundamental question about the investment landscape for assistive technology on the continent. And the truth of the matter is, we cannot achieve sustainability in the AT space if we don't invest in the AT as an industry, meaning that we have to think about the value chain. And sometimes today the keynote speaker was a special envoy to the UN working with the Kenyan government, and he was like, but I need to know this insights and go and report to the high levels. I feel like sometimes in the AT space, in the disability space, we don't know how to talk about how this is an industry. It's not just a few startups. So we have to create like a justification and show that it's investable by thinking about the different sections of this. So what we're gonna do now, just to wrap it up, I wish we could continue with this discussion. But I want to, first of all, just thank you for coming into this session. I think I see a lot of people in this room who are not coming from an investment background. I see a lot of guys in the policy, government. That means that when it comes to investing in assistive tech, we all have a stake, isn't it? So what are you going to do? This is a question that's going out to everybody. But the only people that are going to give a very quick, short response is the panel. But the question is, what are you going to do to improve the investment landscape for assistive technology in Africa? Remember, it's not all about money. So think about that. But then, Mohamed, very quickly, as we wrap it up.
Okay. So my last remark for this session is there should be a common ground where investors, entrepreneurs, and policymakers meet, and I guess that's the maker space or innovation space, because that's the more expensive part. And for example, if an innovation hub or space is provided with some consultancy, for example, regulatory, legal, even for the legal side, like the user guide, we send it to a lawyer for us. So that's a lot of responsibility. So if entrepreneurs find where to innovate, to create, to prototype, but also get guided on how to do that perfectly, that can reduce the risk and improve the success rate of these startups.
Okay, so he's gonna reduce the risk and improve the success rate of his own startup. Then that's gonna make it better. Klaus.
Yep. One of the crucial things is, where can I find the solutions? Where can I find the solutions? I can find it in conferences like this here. I think it should be like in the normal, let's say, startup community, where you have conferences which last a week, where you meet people from all over the world, where the people are really presenting and pitching and all these stuff. Yeah, only in the field of assistive technologies. And we have one of the first points that we have in this thing is that we have global networks of all these, let's say, startup pitching, venture capitalists, etc., marketplaces, and so on. We have it now, yeah? We are working together. We are working together with Enable Africa. We're working together with your organization. There is an Indian company, Enable India, which has this digital innovation solution hub, where it combines marketplaces from all over the world, where you can search for solutions, or Zero project, for example, where you have a database of about 4,000 solutions where you can go in and search for it.
I'm gonna cut you short now.
And pardon?
No, I'm just stealing your time, or you're stealing my time.
Yeah.
Okay.
No, but I think that's the crucial thing, yeah?
Yeah.
If I can't find the solution, if I don't know that the solution is there, yeah, then I perhaps do reinvent the wheel. Yeah?
Okay. So what I hear from Klaus is collaboration.
Correct.
Collaboration, yeah?
Correct.
Collaboration, isn't it?
Collaboration is the point, yeah?
Yeah.
Work together.
I can pick
Amazing.
up on that very quickly,
Wrap
be
it up.
short. So Jaza commits to collaborate with anybody who actually wants to work on pre-investment support, regulatory approvals, etc. we talked about, investment and post-investment support for scale-up, pre-investment and post. So regulatory approval, financial analysis, etc. Thank you.
All right, I hope you took some notes. The homework is for you to go and do something about enabling this space. Thank you very much for filling the room, being very participative, and making this session a great one. Have a good afternoon. Thank you.